We have a 40-year-old male. The patient was involved in a motor vehicle accident. He was riding a motorcycle, struck by another vehicle at about 40 miles per hour. He got a 130 heart rate, BP's 89 over 44, respiratory rate of 28. And we're placing him on oxygen right now.
Mr. Jones first experiences organized chaos as he's brought into the trauma bay. The trauma team takes a report from the EMS team, and the trauma team resuscitates Mr. Jones. After stabilizing him, Mr. Jones is moved to CT scan to identify injuries that were not initially apparent. He's then moved to the operating room. After surgery to repair his injuries, Mr. Jones is admitted to our ICU patient floor. He awakens after a difficult night of not much sleep to a caring nurse.
Hey, how are you? My name is Jenny. I'm your nurse today.
After visits from various clinicians, the respiratory therapist works with Mr. Jones on his breathing exercises and gives him necessary breathing treatments.
I want you to take a nice deep breath. We're going to put this in your mouthpiece. And you're going to take a nice deep breath through it and breathe through it and see how high can you get this up, nice and slow.
Which causes him to cough,
and again.
which in turn means more pain for Mr. Jones, as he has several broken ribs.
Very good.
Hi, Mr. Jones. This is Cassandra. She's going to be taking over the care.
While Mr. Jones is in the hospital, he'll see a variety of professionals who continue to tend to him.
So I'm going to send the strawberry Insuret meals, and then I will also start sending vanilla for lunch and dinner for ice cream.
Ensuring that he is stable and that he'll be able to safely transition back into his normal life.
So I will be reviewing the medications on a fairly regular basis.
Mid-morning, the physical therapist and occupational therapist arrive to get Mr. Jones out of bed, help him to take care of some hygiene issues, and then get him to walk around the floor with his walker. More pain.
Just let me know, okay? If you feel uncomfortable, if you're hurting.
When he gets back to bed, the speech therapist comes in to perform a cognitive evaluation on Mr. Jones, as he has a concussion and might need follow-up therapy.
What I'm going to do next is I'm going to tell you 5 words. And I want you to think of these words. I want you to listen to the words. I'm going to have you repeat them.
The chaplain visits Mr. Jones on a daily basis, providing spiritual support.
Before you presenting you, Mr. Jones, Father God, we just ask for a speedy recovery.
The neurosurgeon visits and does a follow-up with Mr. Jones to check on his progression.
Excellent. I'm going to check here your reflexes.
In the afternoon, the case manager discusses the options for rehabilitation centers, where Mr. Jones can continue to receive therapy after he's discharged, and then makes innumerable phone calls so that Mr. Jones has the best places from which to choose.
I have a list here of the rehab facility that is contracted with your insurance.
While the road to recovery for Mr. Jones has just begun, his journey was made possible by the collaborative approach of Osceola Regional Medical Center's Trauma Center, proving that it takes an entire hospital to be a trauma center.